All right, I have 2 p.m. Dr. Single, do you plan on keeping your camera on for the briefing? Excellent. Dr. Davis, can I go ahead and get started?
Yes,
wonderful.
please.
Good afternoon, everyone. Thank you for joining the Los Angeles County Department of Public Health today, August 25th, for a media briefing. Today, we have Dr. Muntu Davis and Dr. Rita Singhal presenting. Both Dr. Davis and Dr. Singhal will then take your questions. As a reminder, Dr. Singhal will be giving the monkeypox update after Dr. Davis gives the COVID-19 update. If you have questions, please chat me, the host, or you can use the hand raising icon. Dr. Davis, when you're ready.
Thank you, and good afternoon. Thanks to everyone for joining us for today's briefing. As mentioned, I'll give the COVID-19 status update for LA County and review how to access therapeutic medicines to treat COVID. My presentation, again, will be followed by an update on monkeypox by Dr. Rita Singhal, the Chief Medical Director for our department. So I'll take the first slide, please. In the past week, we've seen ongoing declines in new cases and in the number of COVID positive people hospitalized. Today, we're reporting 3,042 new cases with an average of slightly under 3,100 cases per day reported over the past week. This is a 13% decrease from the 7-day average of just over 3,500 cases per day we reported last week. The 7-day average test positivity rate also decreased this week and is currently just under 9% compared to just over 10% last week. As of yesterday, there were 924 COVID positive hospitalized patients in LA County's 92 hospitals, a decline from the 1,009 hospitalized patients last Wednesday. We don't yet have a confirmed number of COVID hospitalized patients. For today, we're awaiting this information from the California Department of Public Health. We reported an average of 13 deaths per day over the past week. This is the same as the week before. Although the number of daily deaths is far lower than during the past winter surge, each death is a blow to families that lost a loved one to this virus, and we wish comfort and healing to them all. I'll take the next slide, please. In this slide, I'll talk about COVID cases, hospitalizations, and deaths. And on this slide, the green trend line demonstrates the significant and ongoing decline in reported cases. The daily hospital admissions, shown by the orange line, have slightly increased after declining for 2 weeks. The 7-day average daily number of admissions as of yesterday's data was 135, compared to 125 a week ago. At the moment, this uptick is primarily associated with more hospitalizations in those who are 70 years and older. We'll continue to monitor this very closely. I will say that modeling from the California Department of Public Health predicts continued declines in hospital admissions across the state and into late September. And given the significant decline in most of our metrics, we're hopeful that hospital admissions will continue to decline for LA County throughout the month, and that this recent uptick in hospital admissions is simply a transient uptick. As noted earlier, shown by the blue line on this slide, the 7-day average number of deaths reported daily remains relatively unchanged. Since changes in death always lag behind cases and hospital admissions, it may take a few more weeks to see further decreases in deaths. Next slide, please. We continue to use the CDC's COVID-19 community levels framework to monitor the strain on our healthcare system caused by COVID-19. The CDC's framework again utilizes 1 case rate metric and 2 hospital-related metrics. For the 3rd week in a row, CDC reports that LA County has been assigned to the medium community level. The first metric used to calculate LA County's COVID-19 community level is the 7-day case rate, which the CDC reported today at 229 weekly cases per 100,000 people, a decrease from the 252 a week ago. The first of the 2 hospital metrics is the 7-day total of new hospital admissions per 100,000. Today, CDC reported LA County's rate as 9.6 weekly hospital admissions per 100,000 people, an increase from 8.9 reported a week ago. This reflects, again, the slight uptick in daily hospital admissions we discussed in the previous slide, and given the significant declines in cases we're currently seeing, we're hopeful that this uptick in admissions will not be a continued trend. Now, the second hospital metric is the 7-day average for the proportion of staffed inpatient beds occupied by COVID-19 patients. Today, CDC reported this metric for LA County to be 5.3%, a decline from the 5.9% they reported a week ago. Note that although there are improvements in the CDC community level metrics, the case rate is still above 200 cases per 100,000 people, indicating that there's still a lot of transmission of the virus occurring. Therefore, it's still recommended to layer in precautions that we have all become familiar with during the pandemic, including masking indoors, staying home and getting tested when ill, making good use of the outdoors and maximizing ventilation indoors, and getting tested before gathering where people of vulnerable health may be present in order to protect them. Next slide, please. I want to also provide a quick update on the COVID-19 early alert signals for LA County. In the past week, there have been decreases in 4 early alert signals. The percent of emergency department visits that are COVID-related decreased from 7.7 to 6.6%. The case rate in the lowest income areas decreased from 202 to 177 weekly cases per 100,000. The number of new outbreaks reported per week in skilled nursing facilities decreased from 19 to 16, and the number of new worksite case clusters per week decreased from 152 to 144. There's no change in the number of wastewater systems with a recent 2-fold increase in viral concentration. It's still 0. And there were increases in 2 early alert signals. The percent of specimens sequence identified as being either BA4 and BA5 subvariants increased as expected. I'll talk more about variants in a few moments. And the number of new outbreaks reported per week in settings for people experiencing homelessness increased from 1 to 13. Note that 2 weeks ago, this number was 11, so most likely having only 1 new outbreak reported last week was an anomaly, but we'll continue to follow that. This week, with the new school year underway, we are again tracking outbreaks in TK through 12 school classrooms, and in the past week, there were 13 outbreaks. I'll review a few early alert signals in more details in the next slide. And I'll take the next slide, please. The Omicron variant continues to account for 100% of sequenced specimens. The BA5 subvariant of Omicron, as shown in the larger red area sections at the top of each bar, remains the predominant subvariant so far. In the week ending October 6, 90% of all sequenced specimens were BA5, a slight increase over the 87 from the week before. The CDC estimates that across the country, as of the week ending August 20th, the BA5 subvariant accounted for 89% of specimens. The relative proportions of other key sublineages we've been tracking have changed only slightly, including BA2.12.1, shown by the orange bars, which has declined to just over 2%, and BA46, shown by the yellow bars, declined slightly from 1.6% to 1%. To date, only 4 specimens of BA2.75 have been detected, only 1 more than last week, indicating no significant increased circulation of this sublineage in LA County. At the moment, there are no new subvariants or sublineages that appear likely to overtake BA5 given the current patterns. This is an encouraging sign for the moment and may allow for further decline in the impact of the pandemic here in LA County. As we discussed before in these briefings, all of the currently circulating subvariants have shown some ability to repeat infections for those who already had COVID earlier in the pandemic and earlier in the year. Repeated infection with COVID may increase the risk of long COVID or of developing other long-term health problems, although more research is needed. In the meantime, as a precaution, it remains prudent to use common sense measures to avoid repeated exposures to yourself and others, including masking, getting tested when you're ill, and isolating at home when you have COVID. I'll take the next slide, please. All 4 sewer sheds that monitor the concentration of SARS-CoV virus in LA County wastewater reported declines in viral concentrations throughout the second half of July and the first half of August. The white trend lines in each graph shows the 10-day rolling average of viral concentration in wastewater between June 29th and mid-August. The dashed blue line shows the average from 2 weeks earlier for each plant, and the dashed yellow line indicates the level that would be a doubling of the average from 2 weeks earlier. As a reminder, since the testing method varies between plants, we compared trends and not absolute viral concentration values. Data from the two largest water treatment plants, the Hyperion Water Reclamation Plant, which serves central and western portions of the county, and the Joint Water Pollution Control Plant, which serves the southern and eastern portions of the county, are shown along the top row. These two plants serve about 7.5 million people in LA County. You can see that both of these large plants had further declines in viral concentration, and last week we reported an uptick in viral concentration at the Hyperion plant, but as you can see, it was followed by further declines. Similar declines in viral concentrations were also reported at two smaller plants along the bottom, Lancaster Water Reclamation Plant serving in Lancaster and Palmdale, and the Tapia Water Reclamation Facility run by Las Virgenes Municipal Water District serving people in Calabasas and surrounding areas. I'll take the next slide, please. Now, I want to give a quick update in terms of what's happening with COVID vaccines and specifically around Novavax. This past week on Friday, August 19th, the FDA granted emergency use authorization for, and a few days later, the CDC updated its guidance for Novavax to be given to children ages 12 to 17 years. Previously, the vaccine was only authorized for adults 18 years and older. The primary series for this vaccine consists of 2 shots given 3 to 8 weeks apart for anyone 12 years and older now. At the moment, there are no booster recommendations after getting a primary series of Novavax. This may change in the future as the vaccine has been in use for a while. Some people have expressed interest in Novavax because it is made using longstanding technology, the same technology that's used for other vaccines, such as the hepatitis B vaccine, as well as the pertussis or whooping cough vaccine. The Novavax vaccine is available in many places throughout LA County. You can find a location offering Novavax by using our website, vaccinatelacounty.com, and click the Find a Vaccine Location link and search for vaccine by vaccine type. Next slide, please. Therapeutic medicines are widely available by prescription for treatment of COVID and to help keep people out of the hospital. A person is considered eligible to take COVID medicine if they tested positive for COVID, they have symptoms, and a healthcare provider has assessed them and prescribed the medication because they have one or more risk factors for developing severe disease. There's a long list of factors for getting very sick from COVID, including being age 50 and older, being unvaccinated or not up to date on vaccination, being pregnant, as well as another long list of underlying health conditions that you see here. Take the next slide, please. As mentioned earlier, we are seeing a slight and hopefully temporary uptick in daily hospital admissions. I want to remind everyone that if you have COVID, have symptoms, and are at higher risk of getting sick, you can get medicines to treat COVID and help keep you out of the hospital. There are 2 general types of medications available for treatment of people who have COVID and who have risk factors for becoming severely ill. Medications that can be taken orally, meaning taken by mouth, and medications that can be given intravenously or into the vein. The oral medications are widely available since they do not require specialized equipment to administer. All of these medications work best when started early in the illness or soon after symptoms start, and while symptoms are mild or moderate. Every treatment for COVID requires first a test for COVID, a medical assessment due to a person's risk factors for severe illness, and a prescription from a healthcare provider. These medications may adversely interact with certain other medications. Therefore, it's really important for a person with COVID to bring a list of their medications with them to the medical consultation so their healthcare provider can review them when considering treatment for COVID. The oral medications to treat people with COVID are Paxlovid and Molnupiravir. Both are antivirals, meaning they block the ability of the virus to multiply inside the body. They should be started within the first 5 days of symptoms in order to be most effective. Paxlovid is the brand name for a treatment that includes 2 different medications that are packaged together and taken together. Paxlovid can be prescribed to people aged 12 and older. It is taken by mouth twice daily for 5 days. Molnupiravir is only for adults 18 years and older and should not be given to a pregnant person. It is taken by mouth twice daily for 5 days as well. There are 2 intravenous drugs available for treatment of COVID, both of which should be started within the first 7 days of symptom onset to be effective. One is an antiviral called remdesivir, which is administered as an intravenous infusion once daily over 3 days. The second is beptolivimab, which is the type of treatment containing what are called monoclonal antibodies, which attach to and neutralize the virus inside the body. It's given as a single intravenous infusion. Since they require special equipment and training, intravenous treatments are more commonly given in hospitals and in specialized clinics that provide infusions. In some cases, a healthcare provider at a site that provides oral medications may decide that intravenous treatment would be best and may refer the patient back to their primary care provider or to another healthcare facility for that reason. Next slide, please. There are over 1,000 healthcare facilities which receive allocations of therapeutic medications to treat COVID. They're located throughout LA County, as you can see on this map. Over half of these facilities are located in what we call HPI plus zip codes, as indicated by the areas with light blue shading on the map. HPI refers to the Healthy Places Index, which ranks the health security of a geographic area by assessing multiple factors that affect health and life expectancy. The HPI plus designation is similar to HPI, but adds a few LA County specific data points. Communities that are considered to be HPI plus are those with the fewest resources and most health risk. 135 of the healthcare facilities that have COVID therapeutics are called test to treat locations, as shown by the pink dots on the map, and are abbreviated on the map as T2T. The Test to Treat program was created by the federal government in partnership with multiple pharmacy chains, and most locations are pharmacies. The majority, 59% of the Test to Treat providers, are located in HPI plus communities. Test to Treat locations are streamlined one-stop locations for assessment of people that have or may have COVID to determine eligibility for a therapeutic medication. They all have the ability to prescribe and dispense medications to treat the symptoms of COVID, so patients can be tested, assessed, and receive medication in one visit. On this map, the gray dots represent other healthcare providers that have received allocations of therapeutics from the county and includes hospitals, clinics, and pharmacies. They're referred to on this map as non-test to treat sites or non-T2T locations, but they all have therapeutics and can provide those treatments if patients are eligible. Public Health continues to onboard additional healthcare providers to become providers of all COVID therapeutics to increase access to these potential life-saving medications for all LA County residents. Next slide, please. COVID therapeutic medications, again, can be life-saving for people with risk factors for developing severe COVID. As a result, they've been provided for free by the federal government for many months up to this point in the pandemic. An important part of public health's work is to partner with healthcare providers to make it as easy as possible to access these free medicines for those that need them. These medications are all currently available for free again, whether you have insurance or not. Note that in some cases, healthcare providers may charge for their medical assessment. At this point, these medications are widely available, and anyone with COVID who has risk factors for severe disease is encouraged to always consult with their own primary care provider first, if you have one. Your own healthcare provider will always know your health best. However, since many practices are very busy, it may be difficult in some cases for a healthcare provider to see a patient quickly on short notice. Since these medications must be started early in the course of illness to be effective, other programs were created to facilitate rapid access. Remember to bring a list of all your medicines you're currently taking because, again, they will be needed to review that list during your assessment in terms of assessing your eligibility for treatment and determining the right treatment. As we discussed in the last slide, there are 135 test to treat sites throughout the county, which provide a streamlined process for getting a COVID test, medical assessment, and prescription all in one visit. Most of them, again, are pharmacies. You can look up test to treat sites through a locator provided by the federal government. The website of the test to treat locator is shown on this slide. And LA County Public Health also provides 2 ways to access free testing, medication or medical assessment, and medications to those who are eligible, regardless of insurance or immigration status. We have 3 multi-service centers that can provide this type of care, and walk-ins are accepted. The 3 centers are located in the Market Street Center in Santa Clarita, Obregon Park in LA and zip code 90063, and Ted Watkins Memorial Park in LA at 90003. All 3 centers are open every Wednesday through Sunday. The service at Market Street Center is available noon until 7, and the other two parks, it's available between 11 and 6 p.m. We also provide help through our public health telehealth program. People can call 833-540-0473 any day of the week between 8 a.m. and 8:30 p.m. We can answer questions, help direct you to test or treat sites near your home, or connect you with one of our healthcare providers for a medical assessment through telehealth. If you're eligible to receive medication, it will be shipped overnight to your home. You can learn more about accessing therapeutic medications to treat COVID at ph.lacounty.gov/COVID medicines. In closing, this has been a very long pandemic, and there have been so many changes throughout it as it has waxed and waned. As new and more transmissible and immune-evasive subvariants have emerged, it's also changed the pandemic. I want to express my gratitude to the many healthcare providers and healthcare workers and community partners across the county who continue to work to protect us all, including our most at risk. Their work to educate about, detect, and stop transmission and to get treatment quickly to the most vulnerable has saved so many lives and continues to do so. And now I'll turn it over to Dr. Singhal, our Chief Medical Director for the LA County Department of Public Health, for an update on monkeypox. After that, we'll be able to answer your questions.
Thank you so much, Dr. Davis. Happy to be here with you today to provide an update on monkeypox. This week, I'll provide a situational update, the demographics and geographic profile of cases in LA County, updates on our vaccine eligibility and distribution, and information regarding monkeypox treatment. I'll go ahead and take the first slide. The number of monkeypox cases continues to rise around the world and here in the United States. As of August 24th, there are over 45,000 cases of monkeypox across 98 countries. This includes over 16,600 confirmed cases in the United States, of which 3,000 cases are in California. As of today, there have been 1,264 cases of monkeypox identified in Los Angeles County. In addition, there have been 68 cases reported in Long Beach and 17 cases reported in Pasadena. Although a month ago we were seeing a doubling of monkeypox cases in as few as 9 days, we are now seeing a leveling in the number of new cases per week, and our doubling time has increased to 16 days. This may be an early indication that transmission is beginning to slow. Similar trends are being noted in countries where the outbreak first began and in other jurisdictions across the United States. The median age of monkeypox cases in LA County remains at 35 years of age. In Los Angeles County, there have been 47 hospitalizations among persons with monkeypox. We are in the process of further characterizing those that have been hospitalized and hope to have more details to share in the future. There have been 5 deaths in countries that have not historically reported monkeypox. However, no deaths due to monkeypox have been reported in Los Angeles County or in the United States. This week, we are reporting a total of 6 cases in congregate settings, which include but are not limited to shelters for persons experiencing homelessness. There are no new jail cases. Next slide, please. Public Health is tracking the demographic and geographic profile of monkeypox cases in LA County. Each Friday, our online data dashboard is updated to include the latest available data. The profile of cases in LA County continues to align with what is being seen across both the country and the world. As of August 19th, 98% of monkeypox cases reported being male. 82% of cases reported their sexual orientation is gay or bisexual, and when excluding cases where sexual orientation is unknown, this increases to 97%. Latinx and white residents continue to account for the largest proportions of cases, representing 38% and 32% of cases respectively. In addition, 12% of monkeypox cases were among Black residents and 4% were among Asian residents. Next slide, please. Although we continue to see monkeypox cases, the risk of monkeypox infection in the general population continues to remain very low in Los Angeles County. Geographically, 46% of cases are in Service Planning Area 4 or the metro region, which is shown in purple on the map. 15% of cases are in Service Planning Area 2 or the San Fernando Valley, and the Santa Clarita Valley region, which is shown in blue. The remaining service planning areas each continue to have 10% or less of the cases, with the fewest cases reported in SPAs 1 and 3. Next slide. Public Health continues to rapidly distribute and administer available monkeypox vaccine doses. We have received over 72,000 doses of the Jynneos vaccine to date under phases 1 through 3 of federal allocations. As of today, Public Health has distributed all of these doses, and 67% of the total doses have been administered. Earlier this week, the federal government announced their phase 4 allocations of over 360,000 vials of the Jynneos vaccine that's being made available to jurisdictions under phase 4. Los Angeles County has been allocated 24,767 vials, or about 120,000 doses. Distribution of phase 4 doses will occur in 3 tranches, with each tranche comprised of 1/3 of the allocation. LA County has just received the first tranche of this allocation, which is 8,260 vials, or about 41,300 doses. The next tranches will be accessible once at least 85% of these vials are administered. We are estimating that with the doses LA County will receive in phase 4, we can fully vaccinate almost 100,000 people with the 2-dose Jynneos series. This is about 56% of the estimated 180,000 at-risk population in LA County. Next slide, please. In response to the phase 4 vaccine allocation announcement, Public Health expanded our vaccine eligibility criteria to include additional residents at high risk for monkeypox. Gay or bisexual men and transgender persons who had multiple or anonymous sex partners in the past 14 days have been eligible for vaccination. Eligibility has now expanded to include gay or bisexual men and transgender persons who have had skin-to-skin or intimate contact, such as kissing and hugging, with persons at large venues or events in the past 14 days. Additionally, persons of any gender or sexual orientation who engaged in commercial and/or transactional sex in the past 14 days, meaning sex in exchange for money, shelter, food, and other goods or needs, are also now eligible for the monkeypox vaccine. Residents who meet prior eligibility criteria remain eligible for vaccination, and we continue to prioritize residents who are immunocompromised, including those with advanced or uncontrolled HIV, since they may be at highest risk for severe disease. Residents who do not have access to the internet or need assistance accessing the vaccine can call the Public Health Call Center at 833-540-0473. Our staff are available to take calls 7 days a week from 8 a.m. to 8:30 p.m. in multiple languages. Next slide, please. Los Angeles County residents who are eligible for their first or second doses of monkeypox vaccine can take advantage of several options to get vaccinated. We now have 53 community providers actively vaccinating their patients for monkeypox. We encourage residents who are eligible for a first dose to contact their regular healthcare provider and ask if they are offering the monkeypox vaccine. Residents who are eligible for their first dose can also pre-register on the Public Health website to get vaccinated through the Public Health and Community Pod sites. This week, in addition to sites in West Hollywood, Silver Lake, El Monte, and Hollywood, we've added a site in Highland Park and another site in Hollywood. The pre-registration link is currently open, and we are taking registrations. We encourage those who are eligible to visit ph.lacounty.gov/monkeypox to pre-register. With the addition of the vaccine doses received last week, Public Health and other providers are now offering second doses to eligible residents. Residents who received their first dose of monkeypox vaccine more than 28 days ago and have not had monkeypox should arrange to get their second dose now. We recommend that residents return to the location where they received their first dose to get their second dose. Those who were vaccinated by their healthcare provider should contact that provider to schedule their appointment for their second dose. Those who registered through the public health registration system and received a first dose at a public health or community pod site will receive a text message with information on how to receive their second dose when it is due. Over 8,000 residents who are due have been invited for their second dose by public health beginning Wednesday of last week. Next slide, please. In the current outbreak, most people with monkeypox have mild illness and recover without any treatment, usually in 2 to 4 weeks. However, the antiviral medication, tecovirimat, which is also known as TPOXX, is available to treat people who have severe disease or complications of monkeypox, or people who are at risk for severe disease. TPOXX is an FDA-approved antiviral medication for the treatment of human smallpox disease. It is also approved to treat monkeypox during outbreaks under an expanded access investigational new drug protocol. TPOXX can shorten the duration of illness caused by monkeypox and reduce the risk of death. Available data indicate that TPOXX is safe and has only minor side effects. A patient's healthcare provider will determine whether to prescribe TPOXX for their patients. Examples of possible indications include having pain or lesions that are so severe that they interfere with activities of daily living, or being at risk for severe illness, including those who are immunocompromised, are younger than 8 years of age, or are pregnant or breastfeeding. For those who don't have a healthcare provider, they can discuss treatment with the public health nurse who is assigned to their case. The public health nurse conducts the initial interview with every case of monkeypox and provides resources and referrals for any needs the case may have. This includes patient navigation to ensure the case has access to a provider for assessment for TPOXX if needed. Next slide, please. TPOXX is readily available in Los Angeles County with 500 sites throughout the county offering this treatment to eligible patients. The medication is pre-positioned at 35 hubs that serve 465 satellite sites, such as health centers, clinics, and all hospitals in LA County. Public health provides logistical and clinical consultation to providers who have questions about the treatment. To ensure access to this important treatment for our underserved communities, Public Health has prioritized the onboarding of sites such as community clinics and federally qualified health centers that serve these populations. We also provide treatment through our own public health clinics and LA County Department of Health Service hospitals. Next slide, please. In closing, we have a variety of monkeypox educational resources available to residents, providers, and community partners on our website. These include FAQs, flyers, pamphlets, signage, and various guidance documents. We encourage them to visit ph.lacounty.gov/monkeypox to access these resources and the latest monkeypox information. Residents can also sign up for our newsletter to receive updates on vaccine availability and pre-registration and other monkeypox updates. And again, residents who do not have access to the internet and need information can call the Public Health Call Center at 1-833-540-0473. We have staff ready to take your call in multiple languages 7 days a week from 8 a.m. to 8:30 p.m. Thank you, and I think we're ready for questions now.
Thank you so much to both of you. We will now take your questions. As a reminder, you can chat me, the host, or you can use the hand raise icon at the bottom of your screen. Our first question comes from Jackie Foitier from KPCC. Oh, excuse me. Sorry, I hit the wrong button. 1 second, Jackie. Jackie, you're unmuted. Go ahead.
Hi there. Thank you. If you could please share with us any Jynneos vaccine equity data or TPOXX equity data, who's receiving the vaccines and who's receiving the TPOXX in LA County. Thank you.
I can begin. So we are looking currently at gathering the data on those that have received the Jynneos vaccine, and we are hoping that we can release that data next week. So please stay tuned. We are going to be looking at the demographics of those that have received. So we will be looking at age, race, ethnicity, and we're hoping to also look at the HPI quartiles that Dr. Davis mentioned that we also use for our COVID data. So we'll be producing that information shortly in the next week or so. On the TPOXX data, this is a little bit tougher. So the information on who is actually being administered the medication is going directly to CDC, and that information does not come back to the local public health department. And so we are working with CDC to try and get that information specific for LA County. Just recently, they have put up information, and it is available on their website regarding the information that they have received about who has received TPOXX medication, and they do have some demographics that are available on their site. In addition to working with CDC, we are setting up a parallel system where we're going to be collecting that information internally ourselves. And so it is going to take a little bit of time for us to catch up on that, to get that information together. So we do not have that data for you right now, but we do hope to have something soon. I do want to say that with the structure that we've set up, we are ensuring that we can make TPOXX available to any provider who wants to treat their patient. So even those that may not be a provider that has pre-positioned TPOXX with them, and it may be someone who has not prescribed TPOXX before, if they have a patient that is eligible, we can work with them and get the medication to them within a day's time so that they can get that medication to their patients. We provide that one-on-one consultation with them and make sure that they can complete the forms that are required by CDC and are eligible to provide that medication. So that is a service that we're working hard on providing and making sure that we have access at every place that any patient may come in.
Our next question comes from Ron Lin from the LA Times. Ron, you're unmuted. Go ahead.
Hi, Drs. Davis and Singhal. Thanks for taking our questions. Really appreciate it. I have a couple questions for each of you. Dr. Davis, we happened to just see a tweet from someone who said that there's an LAUSD elementary school where a parent says that 60% of the teaching staff is out with COVID. Can you confirm if that's true, or if there are any sites like that seeing such disproportionate impact on an outbreak? And also, we noticed a large cluster of coronavirus cases at 2 Google work sites in LA County. Are there any particular concerns about that cluster of cases, and do we know if it's actually an outbreak in which transmission is occurring at that site? And then, Dr. Singhal, regarding the slowdown in monkeypox cases, can you explain why we might be seeing this, not only here but elsewhere? And then lastly, is the department still issuing stay-at-home orders for people who contract monkeypox? And if not, what guidance are you giving people for isolation? And if there are any resources you can provide for people who are unable to work for a month? Thanks.
So thanks, Ron, for those questions. Let me start. First, I'll say in general, whenever we have investigations, we don't typically give lots of details in relationship to those, especially regarding some specific sites other than what we post online. I will say that in general, when we do have outbreaks, within a setting, workplace or other, typically you're going to see the same things that we see and we try to prevent. That means, someone who's there may or may not know that they have COVID. There most likely isn't masking, or at least there may be some breaks in masking if that's what is the policy inside of that location as well. And there's enough close contact in order for the virus to be transmitted. And so you can imagine that most of these are going to be in general the same in terms of what's going to be the factors that contributed to the outbreak. Again, why it's really important for people to ensure that if they feel sick, even with mild symptoms, to test themselves and make sure that they don't have COVID. And we are also aware that there have been some studies that have shown in the past that even up to about 56% of people didn't know they had an infection. So again, one of the reasons to encourage masking indoors, even though it's not a requirement, because there's still a lot of circulation of the virus in the community at the moment. Again, we don't typically go into lots of details, but generally that's what we see when we look across many of our outbreaks that are investigated.
Thanks, Ron. I can take the monkeypox question. So, yes. So the first question, I think, regarding the slowdown in monkeypox cases. So I don't know exactly why, but I can make some guesses on this. So I think first off, what we do know about monkeypox is that it's not like COVID. It does not transmit as easily as COVID does. It does require prolonged close contact. And so in that, in a scenario like that, when you have an infectious agent like that, it is going to what we call burn out faster when it's out in a community or among a group of people. And so so that in itself, just given that how this virus transmits and just what is required for it to be moving within our community and transmitting is probably one of the reasons that we are going to start seeing a slowing down, unlike what we have seen with COVID. The other thing also is that other contributing factors could be is that we have seen, there was a study that was released, CDC has done some work at looking at behavior change, and they do have this information up on their website, but they did do a survey with gay, bisexual, and other men who have sex with men, where they looked at whether they had changed their behaviors regarding the number of sexual partners that they've had and their sexual activity. And there was some significant decreases that were noted among those that had responded to that survey. So there might have been some change in behavior that also is contributing to decreased transmission. And then, of course, vaccination, getting vaccine out has hopefully contributed as well, although it has been slow and has been limited in many ways. You know, getting as whatever amount that we can get out and vaccinating folks has hopefully helped as well. So I think those are probably the main factors that are contributing to it. But we'll wait and see. I mean, we're being cautiously optimistic that this is going to be real and that it will hold. I can say for us here in LA County, it's a leveling off. I would not say that it's decreasing yet. And so we do want to make sure that we keep an eye on this, and we'll have more information on it next week. I will now move to the second question I think you had on monkeypox, which is that are we providing stay-at-home orders, and what is our guidance around isolation? So what I can say is that, as I mentioned earlier, we are still doing case interviews and contact tracing. So for all monkeypox cases, we are contacting and speaking to the case. We are providing education on what they need to do, and that includes their instructions on isolation. We do have a isolation guidance document that we provide to them, a written guidance that they have so that they know what they should be doing. And so for the most part, they do need to be isolating in a location. And most likely that's going to be at home, but for those that, you know, need to be elsewhere, you know, there is somewhere where they can isolate and have their own space, where there's others that are not present. There are certain circumstances when they are allowed to go out, and this includes, you know, in locations where it's not going to be high risk, where they can keep their lesions covered as long as they do not have any active respiratory symptoms or fever. So there's a few different guidance that we provide as to when they can leave isolation. Regarding work, you know, this is a difficult situation. We do know that it is a fairly long disease course for monkeypox, so there may be people that need to be out of work for 2 or 3 weeks if they do get it. And so in those scenarios, you know, we're hoping that if there is a low risk setting where they can work from, where they are not in contact with others and they're not going to have any prolonged exposure with others, that they may be able to work. But that is something that we are looking at on a case-by-case basis. Of course, the best thing would be is for them to be able to stay home and to work remotely, but we know that that's not an option for everyone.
I do want to also note that, you know, as we've been in discussion with the state as well, you know, the most common route of transmission that has been identified in terms of this global outbreak has really been direct skin-to-skin contact with monkeypox lesions. And that's including sexual contact, but not limited to that, as well as close contact with households or contaminated items. But it really is most commonly in that way. And so I think as we think about isolation at home and worry like with COVID in terms of respiratory, it's not the same as Dr. Sangal mentioned. So again, the risk should be much lower, especially as lesions can be covered and as long as the person doesn't have symptoms, respiratory symptoms as well.
Shall we move on to the next question? Was that everything?
Yes.
Wonderful. Our next question comes from Marla Tejas from Fox 11. Marla, you're unmuted. Go ahead.
Thank you so much. Thank you, doctors. Dr. Davis, I have a few questions for you, and then I have a question for you as well, Dr. Singhal. Dr. Davis, yesterday, the LA County USC Medical Center, they held their virtual briefing, and one of the doctors said, and this is a quote, "We continue to virtually have no patients admitted to the hospital due to COVID." And then he goes on to say that there are 3 patients in County USC Medical Center due to COVID, admitted there due to COVID. So 35 total COVID positive patients, 3 there, and he says arguably due to COVID. How do these numbers, what is your reaction to that? Just given that it is such a mild disease out there right now, and the numbers that are presented here with 924 cases, just what is your reaction to that? And do these numbers square up with the hospitalization numbers that you present? Also, with that said, what is the future of the transportation mask mandate that we know that only LA County has? When will that be rescinded? I understand that that's reviewed every 30 days. What is the latest with that? And then Dr. Singhal, in terms of the monkeypox vaccine, and I know the limited stockpile, is LA County actively splitting the doses in order to stretch the limited vaccine supply? Thank you.
I appreciate those questions. What I will note is, we report on the 92 hospitals that are within LA County. And what we've seen over the course of this pandemic is that each hospital has varying degrees of how many patients they have. Some have many fewer than others, but in either case, the numbers that we compile are from all of the hospitals and the patients diagnosed with COVID. We also put up on our website, in terms of hospitalizations, those that are admitted with COVID-associated illness and those that have incidental COVID illness. So we are tracking this. We understand, again, that hospitals are going to have different experiences based on their population and whether or not they were previously infected more recently or not. But in general, our numbers are full county numbers in terms of all of the hospitals. But not surprised to hear that hospitals may have different experiences in terms of what they're seeing in terms of COVID patients being admitted, or patients being admitted with COVID or incidentally diagnosed with COVID on admission. I think in general, thinking about the transportation masking requirement, as we continue to see high transmission, just in terms of being above 200, we are, evaluating what things should remain in place. But with high transmission, with a history of the transport industry having high infection, high hospitalization rates as well, and there have been studies recently published specifically focused in on the transit sector, we think that this is still a prudent measure at this moment. It was renewed earlier this month, and we will review it, as we said, every 30 days. It may change as our COVID case rate starts to go down. But at the moment, we continue to monitor it and think it's an appropriate measure at the moment, given the potential risk in that setting and what we've seen in the past. In terms of thinking about the vaccine, I'll just start this question, Dr. Singhal. It's not a question of splitting the doses. This is really an authorized and alternative use of it in a different way that allows for a smaller dose of the vaccine to be given in order to have the same response. But those have been looked at, that has been used, and does help in order to get more of a limited supply of vaccine to more people who are at higher risk of exposure. So it is something that is being implemented by many of our providers here in LA County and across the state, and with the exceptions of those who are under 18 or who have a history of keloid formation, those would get the standard dose in terms of subcutaneous. But otherwise, the direction has been from the federal government to plan for intradermal, and that's what we've communicated with our providers, and that's what they're doing at the moment. Dr. Singhal, feel free to add to that if you'd like.
That's absolutely correct. we have transitioned us to this alternate regimen, knowing that this regimen has equal immune response to the standard regimen. You've already given the indications of when we would do the subcutaneous, so yes.
We have a follow-up from Marla. Go ahead, Marla.
Thank you. My follow-up, Dr. Davis, about the transportation mask mandate then, noting that we have moved from high to medium transmission. Is this all about the case rate, or do you look at hospitalizations for the mask mandate on transportation services? Will it be that once we get to low transmission that the mask mandate will be rescinded? And then in terms of hospitalizations, is it still about 40% according to your numbers that are there due to COVID? And that's it. Thank you so much.
Sure. Thank you for the follow-up. So I'll start with the hospital numbers. So it's about 43% as of the month of June, meaning 57% were admitted as quote unquote incidental detection, 43% admitted with COVID associated illness. And that information is on our demographics website under hospitalizations. And so we keep that up there. So that's what we're seeing. That was consistent with the prior month as well, being at 43 and 57%. I will say that from April to June, it did increase. Originally in April, it was about 39% was COVID-associated illness and went up to 43% in May and June. So there was some change, I believe, as we have seen, with the different sublineages circulating within LA County as well. In terms of transportation, the move from high to medium was not high to medium transmission. It was simply the measure of the impact of COVID in terms of the community level established by the CDC, which includes the case rate or the transmission rate per 100,000 people, in addition to hospital metrics. So our transmission rate is actually still very high. We are still above 200, and that is what is really being looked at as we look at all high-risk settings, including healthcare settings, and the state has indicated that, and the CDC has indicated that as well. Community transmission rates in terms of high-risk settings is usually what is used to look at those. But we are continuing to look at how we plan for and move forward in this, and hopefully as we get a little bit clearer on what we want to do or what we recommend and what the CDC and the state will recommend as we move into our winter months, it'll get better, that we'll be able to provide some more information in terms of any updates that we may want to give.
Our next question comes from Emily Valdez from KNX. Emily, you're unmuted. Go ahead. Emily, are you there? Okay, Emily, if you'd like to chat in your question, we can try to get to you. In the meantime, I'll go on to our next question, which is from Troy Masters. Troy, you're unmuted. Please go ahead.
Hi, my name is Troy Masters. I'm publisher of the Los Angeles Blade. We're the LGBT newspaper for LA. And my question is about for those vaccinated with a full dosage of the first inoculation of monkeypox vaccine, is a 20% shot really necessary? That's one question. And I have another question about where you came up with the 180,000 population at risk number. That seems rather low to me based on anecdotal information. And finally, a comment. One thing that might contribute to a perceived drop in cases is that many people have quit reporting their illness because it's mild. I'm aware of this from numerous friends, and they keep an eye on it. If it gets out of control, they then contact their doctor. So far, only a couple have happened that way, but I appreciate it. Thank you very much.
So I can start, Dr. Singhal, if you'd like. In terms of the second dose, if someone got the standard dose in terms of the subcutaneous dose, this is a 2-dose vaccine. So getting the second dose is what was authorized and what is recommended. If you got the standard dose subcutaneously, you can get the intradermal, and it's okay. That is okay to move from that to the other. And I still think it's warranted just because, again, this is a 2-dose vaccine. In terms of just the comment about cases and not reporting, although we understand it may be a mild illness, there may be others that come into contact with them that it could end up transmitting to them and cause infection and then continue spread. So even though it's a mild illness, it's not something we have typically seen here. It's not something we want to continue to see here. And we do hope that people do report, at least to make sure that we can get in contact and provide information and guidance, or potentially provide vaccination to prevent illness, and anyone that may have been in close contact with them as well. So it really is helpful, not just to think about the illness that you have, but the others that may have been infected and who could potentially be prevented from getting the illness with vaccination, and helping us as a community really stop the transmission of this illness. And then I missed the second question, Dr. Singhal. Did you get that one as well?
Sure. I think the second question was regarding how did we come up with our 180,000 at-risk population? And so I can begin on that. So I will say, so a little bit of this is arbitrary, and the at-risk population, it may change as we see how we progress with this outbreak. The number that we came up with is actually higher than what CDC has for us. So, some of our vaccine allocation is based on this at-risk population number. And so the way that we came up with it was we looked at those that were HIV positive, gay, bisexual men, and other men who have sex with men, which we estimated was about 42,000 people in LA County. And then we looked at those that were HIV negative, also gay, bisexual men who have sex with men that have multiple partners. So that number was a little bit higher at about 140,000. So by putting those together, that's how we came up with 180,000 at-risk population. So these numbers are estimates. So I will say that first off, they are estimates, and it is based on, for example, those with multiple partners. That does come from the National Health Behavior Survey, which just estimates what number or what percentage of the population has, that specific health behavior. And so it is an estimate, but that is how we came up with our numbers. And we're happy to talk with you offline if there's any different sources or other numbers that are available out there, and to look at what that at-risk population would be.
I would add that, in general, our main goal is to get it to anyone who is at high risk for exposure. So the numbers, although they're used in order to help figure out how much vaccine is allocated to us, we really want to make sure that anyone's at high risk and eligible gets access to the vaccine, and we try to make that as easy as possible. So, we will continue to promote that. No matter who you are, if you are at high risk, we want you to be vaccinated to protect yourself and others. And that's really most important to us.
Okay, to wrap up, I'm going to give you Emily's question. Her question is about the Omicron booster. She wanted to know when we might be seeing that and what type of priority groups are we looking at?
Well, it's a good question. I mean, I think we've seen a lot in the news about both Pfizer and Moderna putting forth their applications to the FDA to have their boosters, their Omicron specific or bivalent boosters approved. We don't know, we haven't seen any dates of when that may happen. And we don't know exactly once the FDA advisory committee looks at it, what they will recommend and to which specific groups, and what the CDC will recommend after they give approval if they do. There are some talk in media about it being potentially available as early as September, but we haven't seen anything official just yet. But we are planning for whenever it comes out to get it to all of our vaccination providers in order to get to those who it's eligible for. We do know that at least in terms of the application, I believe Pfizer put in for 12 and older for their booster, as well as Moderna, I believe, is 18 and older for their booster. But again, that's what they put on their application. It depends on what the scientists who review the applications say makes the most sense given the data that's presented to them. And so we remain to see what those details are, but those are the same things I think all of you have seen in media, but we don't have anything official as to exactly when and exactly who, just what we know about in terms of the application so far.
That concludes our briefing. Any closing remarks, Dr. Davis? Dr. Singal?
I really just want to thank all of you who participate in these and appreciate your questions as well. Again, you are an integral part to getting accurate information out to the community. There are multiple sources of information, and so we hope this is helpful for you and for your viewers and readers. So thank you again for your help and participation in getting information out.
All right, wonderful. Thank you again for everyone who has joined us today. If you stick around, we have Spanish remarks in about 5 minutes. Any additional media questions can be sent to our media inbox at media@ph.lacounty.gov. Thank you. Good afternoon, Jackie. Would you like to get started? Yeah, that'd be great. Okay, let me get your slides up here. Okay, all right. Good afternoon, everyone. Thank you so much for joining Los Angeles County Department of Public Health today, August 25th, for the Spanish portion of today's briefing. Today we have Jackie presenting. Jackie, when you are ready.
Great, thank you so much. Give me 1 second. En la última semana, perdón, déjeme empezar por el principio. Buenas tardes y gracias por acompañarnos durante esta sesión informativa. Hoy daré una actualización del estado de COVID-19 para el condado de Los Ángeles y repasaré cómo acceder a medicamento terapéutico para tratar COVID. Después seguiré con una actualización sobre la viruela del mono. First slide, please. En la última semana hemos visto disminuciones continuas en casos nuevos y en el número de personas con COVID que están hospitalizadas. Hoy reportamos 3,042 casos nuevos con un promedio un poco por debajo de 3,100 casos por día que informamos sobre la semana pasada. Esto refleja una disminución del 13% del promedio de 7 días de poco más de 3,500 casos por día que informamos la semana pasada. El promedio de 7 días de la tasa de positividad de la prueba también disminuyó esta semana y actualmente está justo sobre 9% en comparación con un poco más del 10% la semana pasada. A partir de ayer, había 924 pacientes hospitalizados con COVID en los 92 hospitales en el condado de Los Ángeles, una disminución de los 1,009 pacientes hospitalizados el miércoles pasado. Todavía no tenemos un número confirmado de pacientes hospitalizados que tienen COVID para el día de hoy y estamos esperando esta información del Departamento de Salud Pública del estado. Reportamos un promedio de 13 muertes por día durante la semana pasada, igual que la semana pasada. Y aunque la cantidad de muertes diarias es mucho por debajo de lo que vimos durante la oleada, pasadas oleadas invernales, cada fallecimiento es una tragedia para las familias que perdieron a un ser querido a causa de este virus. Y deseamos consuelo y sanación a todos ellos. Next slide, please. La línea de tendencia verde muestra el descenso significativo en el número de casos reportados. Los ingresos hospitalarios diarios, la línea anaranjada, ha aumentado levemente después de disminuir por 2 semanas. El número promedio de ingresos diarios de 7 días a partir de los datos de ayer es de 135 en comparación con 125 de hace una semana. En este momento, este pequeño aumento se ha asociado principalmente con más hospitalizaciones entre personas de 70 años o mayores. Continuaremos vigilando esto muy de cerca. Los datos del Departamento de Salud Pública de California pronostican descensos continuos en las admisiones hospitalarias a través del estado hasta fines de septiembre. Dado el descenso significativo en la mayoría de nuestros indicadores, estamos esperanzados que las administraciones hospitalarias continuarán disminuyendo en el condado de Los Ángeles durante el mes y que este aumento reciente en los ingresos hospitalarios sea pasajero. Como se señaló anteriormente y se muestra en la línea azul de esta gráfica, el promedio de 7 días de muertes notificadas diariamente permanece relativamente sin cambios. Dado que los cambios en las muertes siempre están un poco por detrás de los casos y las admisiones hospitalarias, es posible que pasen algunas semanas más antes de que se observen más disminuciones en fallecimientos. Next slide, please. Utilizamos el marco de niveles comunitarios de COVID-19 de los CDC para vigilar la sobrecarga de nuestro sistema de atención médica causada por COVID. Este marco de los CDC utiliza una métrica de tasa de casos y 2 métricas hospitalarias. Por tercera semana consecutiva, los CDC informa que el condado de Los Ángeles sigue en el nivel comunitario medio. La primera métrica que se usa para calcular el nivel comunitario de COVID del condado de Los Ángeles es la tasa de casos de 7 días que los CDC reportaron hoy es de 229 casos semanales por cada 100,000 personas, una disminución de los 252 casos de hace una semana. La primera de las dos métricas hospitalarias es el total de 7 días de nuevas admisiones hospitalarias por cada 100,000 personas. Hoy los CDC reportaron que la tasa del condado de Los Ángeles es de 9.6 admisiones hospitalarias semanales por cada 100,000 personas, un aumento con respecto al 8.9 reportado hace una semana. Esto refleja un pequeño aumento en los ingresos hospitalarios diarios que mencionamos en la gráfica anterior. Dado los descensos significativos en casos que estamos viendo actualmente, tenemos esperanza que este pequeño aumento en admisiones hospitalarias no será una tendencia continua. La segunda métrica hospitalaria es el promedio de 7 días de la proporción de camas dentro de hospitales que tienen personal y están ocupadas por pacientes con COVID. Hoy los CDC reportaron que el condado de Los Ángeles está en 5.3%, una disminución del 5.9% que se reportó la semana pasada. Hay que estar conscientes de que, aunque hay mejoras en las métricas de nivel comunitario de los CDC, la tasa de casos todavía está por demás de 200 casos semanales por cada 100,000 personas, cual indica que todavía hay mucha transmisión viral. Y por eso todavía es recomendable agregar capas de precauciones con las que nos familiarizamos durante la pandemia. Por ejemplo, utilizar mascarillas en espacios interiores, quedarnos en casa y hacernos la prueba cuando estamos enfermos, hacer buen uso de las afueras y maximizar la ventilación en espacios interiores y hacernos la prueba antes de ir a una reunión donde estarán presentes personas que tienen condiciones de salud delicadas para protegerlos. Next slide, please. Ahora voy a dar una actualización rápida sobre las señales de alerta temprana de COVID para el condado de Los Ángeles. En la última semana hubo reducciones en 4 señales de alerta temprana. El porcentaje de visitas al departamento de emergencias relacionadas con COVID bajó de 7.7% a 6.6%. La tasa de casos en las áreas de ingresos más bajos bajó de 202 a 177 casos semanales por cada 100,000 personas. El número de brotes reportadas por semana en centros de enfermería especializada se redujo de 19 a 16. Y el número de grupos de casos en sitios de trabajo por semana disminuyó de 152 a 144. No hubo cambios en el número de sistemas de aguas residuales con un aumento reciente del doble de la concentración viral. Todavía es 0. Sí hubo aumentos en 2 señales de alerta temprana. El porcentaje de muestras secuenciadas identificadas como subvariantes BA.4 y BA.5 aumentó como se esperaba y hablaré más sobre las variantes en unos momentos. El número de nuevos brotes informados por semana en entornos para personas sin hogar aumentó de 1 a 13. Tenga en cuenta que hace 2 semanas este número era de 11 brotes. Por lo tanto, lo más probable es que solo se haya informado un brote nuevo la semana pasada, una anomalía. Esta semana, con el nuevo año escolar en marcha, nuevamente estamos rastreando brotes en las aulas de las escuelas de kinder de transición al 12 grado. En la última semana hubo 13 brotes. Repasaré algunas señales de alerta temprana con más detalle en las próximas gráficas. Next slide, please. La variante Omicron sigue representando el 100% de las muestras secuenciadas. La subvariante BA.5 de Omicron, en las secciones rojas más vivas en la parte superior de cada barra, sigue predominando. En la semana que terminó el 6 de agosto, el 90% de las muestras secuenciadas fueron BA.5, un leve aumento en comparación con el 87% reportado la semana pasada. Los CDC estiman que en todo el país, a partir de la semana que terminó el 20 de agosto, la subvariante BA.5 representó el 89% de las muestras. Las proporciones relativas de otros sublinajes claves que hemos rastreado han cambiado solo un poco, incluso BA.2.12.1, las barras anaranjadas, ha disminuido a poco por demás de a un poco por demás de 2%. Y BA.4.6, las barras amarillas, ha disminuido de 1.6% a 1%. Hasta la fecha, solo se han detectado 4 muestras de BA.2.75, solo una más que la semana pasada, lo que indica que no se ha elevado la circulación de este sublinaje en el condado de Los Ángeles. Por el momento, no hay nuevas subvariantes o sublinajes que parezcan probables de superar a BA.5, dado los patrones actuales. Esta es una señal alentadora por el momento y puede permitir una mayor disminución en el impacto de la pandemia. Como discutimos anteriormente en estos informes, todas las subvariantes que circulan actualmente han demostrado cierta capacidad para causar infecciones repetidas para aquellos que ya tuvieron COVID a principios de la pandemia o a principios de año. La infección repetida con COVID puede aumentar el riesgo de COVID prolongado o de desarrollar otros problemas de salud a largo plazo, aunque eso necesita más investigación. Mientras tanto, como precaución, sigue siendo prudente utilizar medidas de sentido común para evitar la exposición repetida para usted mismo y para los demás, incluido el uso de mascarillas en interiores, hacerse la prueba cuando está enfermo y aislarse en casa cuando tiene COVID. Next slide, please. Las 4 plantas que monitorean la concentración del virus SARS-CoV-2 en las aguas residuales del condado de Los Ángeles reportaron disminuciones en la concentración viral durante la segunda quincena de julio y la primera quincena de agosto. La línea de tendencia blanca en cada gráfico muestra el promedio móvil de 10 días de la concentración viral en las aguas residuales entre el 29 de junio y mediados de agosto. La línea discontinua azul muestra el promedio de las 2 semanas anteriores para cada planta y la línea discontinua amarilla indica el nivel que sería una duplicación del promedio de las 2 semanas pasadas. Les recordamos, dado que el método de prueba varía entre las plantas, comparamos tendencias y no valores absolutos de concentración viral. En la fila superior se muestran los datos de las 2 plantas de tratamiento de aguas residuales más grandes. La planta de recuperación de agua Hyperion, que atiende las partes central y occidental del condado, y la planta conjunta para el control de la contaminación del agua, que atiende a las partes sur y este del condado. Juntas, estas 2 plantas sirven alrededor de 7.5 millones de personas en el condado de Los Ángeles. Puede ver que estas 2 plantas grandes tuvieron disminuciones continuas en la concentración viral. La semana pasada informamos un aumento en la concentración viral en la planta Hyperion, pero como puede ver, fue seguido por más descensos. También se informaron disminuciones similares en las concentraciones virales en 2 plantas más pequeñas que se muestran en la parte inferior de esta gráfica. La planta de recuperación de agua de Lancaster, que atiende a personas en Lancaster y Palmdale, y la instalación de recuperación de agua de Tapia, administrada por el Distrito Municipal de Agua de las Vírgenes, que atiende a personas en Calabazas y sus alrededores. Next slide, please. Ahora daré una actualización rápida sobre Novavax. La semana pasada, el viernes 19 de agosto, la FDA otorgó la autorización de uso de emergencia y unos días después los CDC actualizaron su guía para que Novavax se administre a niños de 12 a 17 años. Anteriormente, la vacuna estaba autorizada solo para adultos de 18 años o mayores. La serie primaria para esta vacuna consta de 2 inyecciones administradas con 3 a 8 semanas de diferencia para cualquier persona mayor de 12 años. Por el momento, no existe una recomendación de refuerzo después de recibir una serie primaria de vacunas de Novavax. Esto puede cambiar en el futuro después de que la vacuna haya estado en uso por un tiempo. Algunas personas han expresado interés en la vacuna Novavax porque se fabrica utilizando una tecnología de vacunas de larga data utilizada para otras vacunas como la vacuna contra la hepatitis B y la tosferina. La vacuna Novavax está disponible en muchos lugares a través del condado de Los Ángeles. Puede encontrar una ubicación que ofrezca Novavax utilizando nuestro sitio web, vacunatelosangeles.com, y oprima el enlace que dice haga clic aquí para vacunarse y busque por tipo de vacuna. Next slide, please. Los medicamentos terapéuticos están ampliamente disponibles con receta para el tratamiento de los síntomas de COVID y para ayudar a las personas a evitar tener que ir al hospital. Una persona se considera que es elegible para tomar el medicamento si ha dado positivo en la prueba de COVID, tiene síntomas y un proveedor de atención médica lo evaluó y le recetó el medicamento porque tiene uno o más factores de riesgo de desarrollar una enfermedad grave. Hay una larga lista de factores de riesgo para enfermarse gravemente de COVID, que incluyen tener 50 años o más, no estar vacunado o no estar al día con las vacunas, estar embarazada, así como una larga lista de otras condiciones de salud subyacentes. Next slide, please. Como se mencionó anteriormente, estamos viendo un aumento leve y con suerte temporal en las admisiones hospitalarias diarias. Queremos recordarles a todos que si tienen COVID, tienen síntomas y corren un mayor riesgo de enfermarse gravemente, puede obtener medicamentos para tratar el COVID y ayudarlo a mantenerse fuera del hospital. Hay 2 tipos generales de medicamentos disponibles para el tratamiento de personas que tienen COVID y que tienen factores de riesgo de enfermarse gravemente. Medicamentos que se toman por vía oral, es decir, por la boca, y medicamentos que se administran por vía intravenosa, o sea, en una vena. Los medicamentos orales están más disponibles ya que no requieren ningún equipo especializado para administrarlos. Todos estos medicamentos funcionan mejor cuando se comienzan a tomar al comienzo de la enfermedad, poco después de que comiencen los síntomas y mientras los síntomas aún son leves o moderados. Cada tratamiento para COVID primero requiere una prueba de COVID y una evaluación médica debido al riesgo de enfermedad grave de una persona y una receta de un proveedor de atención médica. Estos medicamentos pueden interactuar negativamente con ciertos otros medicamentos. Por lo tanto, es realmente importante que una persona con COVID traiga una lista de sus medicamentos a su consulta para que su proveedor de atención médica pueda revisarlos. Los medicamentos orales para tratar a personas con COVID son Paxlovid y Molnupiravir. Ambos son antivirales, lo que significa que bloquean la capacidad del virus para multiplicarse dentro del cuerpo. Deben comenzarse dentro de los primeros 5 días de síntomas para que sean efectivos. Paxlovid es el nombre comercial de un tratamiento que incluye 2 medicamentos diferentes que se envasan juntos y se toman juntos. Paxlovid se puede recetar a personas mayores de 12 años. Se toma por vía oral 2 veces al día durante 5 días. Molnupiravir es solo para adultos mayores de 18 años y no debe administrarse a una persona embarazada. Se toma por vía oral 2 veces al día durante 5 días. Hay 2 medicamentos intravenosos disponibles para el tratamiento de los síntomas de COVID, los cuales deben iniciarse dentro de los primeros 7 días del inicio de los síntomas para que sean efectivos. Uno es un antiviral llamado Remdesivir, que se administra como infusión intravenosa una vez al día durante 3 días. El segundo se llama Bebtelovimab, que es un tipo de tratamiento que contiene lo que se llama anticuerpos monoclonales que se adhieren y neutralizan el virus en el cuerpo. Esta medicina se administra como una infusión intravenosa única. Dado que requieren equipo y capacitación especiales, los tratamientos intravenosos se administran más comúnmente en hospitales y en clínicas especializadas que brindan infusiones. En algunos casos, un proveedor de atención médica en un sitio que proporciona medicamentos orales puede decidir que el tratamiento intravenoso sería mejor y puede remitir al paciente a su médico de atención primaria a otro centro de atención médico por ese motivo. Next slide, please. Hay más de 1,000 centros de atención médica que reciben asignaciones de medicamentos terapéuticos para tratar el COVID, ubicados en todo el condado de Los Ángeles. Más de la mitad de estas instalaciones están ubicadas en lo que llamamos códigos postales HPI+, como lo indican las áreas en azul claro en el mapa. HPI, por sus siglas en inglés, se refiere al índice de lugares saludables, que clasifica la seguridad de la salud de una área geográfica mediante la evaluación de múltiples factores que afectan la salud y la expectativa de vida. La designación HPI Plus es similar a HPI, pero agrega algunos puntos de datos específicos del condado de Los Ángeles. Las comunidades que se consideran HPI Plus son aquellas con menos recursos y más riesgos para la salud. 135 de los centros de atención médica que cuentan con un medicamento terapéutico para el COVID son ubicaciones de prueba para tratar o test to treat en inglés. Como lo muestran los puntos rosados en el mapa y se abrevian en el mapa como T2T por sus siglas en inglés. El programa de prueba para tratar fue creado por el gobierno federal en asociación con múltiples cadenas de farmacias y la mayoría de las ubicaciones son farmacias. La mayoría, 59% de los proveedores de prueba para tratar, están ubicados en comunidades HPI+. Los lugares de prueba para tratar son lugares optimizados, ubicaciones que sirven como solo una parada para la evaluación de personas que tienen o pueden tener COVID para determinar la elegibilidad para un medicamento terapéutico. Todos ellos tienen la capacidad de recetar y dispensar medicamentos para tratar los síntomas de COVID, de modo que los pacientes pueden ser examinados, evaluados y recibir medicamentos en una sola visita. En este mapa, los puntos grises representan otros proveedores de atención médica que han recibido asignaciones de medicamentos terapéuticos a través del Departamento de Salud Pública del Condado de Los Ángeles e incluyen hospitales, clínicas y farmacias. En este mapa se les domina ubicaciones que no son de prueba para tratar o que no son T2T. Salud Pública continúa incorporando proveedores de atención médica adicionales para convertirse en proveedores de todas las terapias de COVID para aumentar el acceso a estos medicamentos que pueden salvar vidas para todos los residentes del condado de Los Ángeles. Next slide, please. Los medicamentos terapéuticos para COVID pueden salvar la vida de las personas con riesgo de desarrollar una enfermedad grave por COVID. Como resultado, el gobierno federal los ha proporcionado de forma gratuita durante muchos meses hasta este punto de la pandemia. Una parte importante del trabajo de salud pública es asociarse con proveedores de atención médica para facilitar el acceso a estos medicamentos gratuitos para quienes lo necesitan. Actualmente todos estos medicamentos están disponibles de forma gratuita, ya sea que tenga seguro médico o no. Tenga en cuenta que en algunos casos los proveedores de atención médica pueden cobrar por su evaluación médica. En este momento, estos medicamentos están ampliamente disponibles. Se recomienda a cualquier persona con COVID que tenga factores de riesgo de enfermedad grave que siempre consulte primero con su propio proveedor de atención médica primaria, si tiene uno. Su propio proveedor de atención médica siempre conocerá mejor su historial médico. Sin embargo, debido a que muchas prácticas médicas están muy ocupadas, en algunos casos puede ser difícil para un proveedor de atención médica ver a un paciente rápidamente. Dado que estos medicamentos deben iniciarse temprano en el curso de la enfermedad para que sean efectivos, se crearon otros programas para facilitar el acceso rápido. Recuerde traer una lista de todos los medicamentos que está tomando actualmente porque necesitan revisar esa lista. Como discutimos en la última gráfica, hay 135 sitios de prueba para tratar en todo el condado y quienes brindan un proceso simplificado para obtener una prueba de COVID, una evaluación médica y una receta, todo en una sola visita. La mayoría son farmacias. Puede buscar sitios de prueba para tratar a través de un localizador proporcionado por el gobierno federal. El sitio web del Test to Treat Locator se muestra en esta gráfica. El Departamento de Salud Pública del Condado de Los Ángeles también ofrece dos formas de acceder a pruebas, evaluaciones médicas y medicamentos gratuitos para aquellos que son elegibles, independientemente de que si tiene seguro o no o de su estado migratorio. Contamos con 3 centros de servicios múltiples que pueden brindar este tipo de atención y se aceptan visitas sin cita previa. Estos 3 centros están ubicados en Market Street Center en Santa Clarita, el Parque Obregón en Los Ángeles, en el código postal 90063, y en el Parque Ted Watkins Memorial Park en Los Ángeles, en el código postal de 9002. Estos 3 centros están abiertos de miércoles a domingo. El servicio en Market Street Center está disponible desde el mediodía hasta las 7 de la noche y en los otros 2 parques está disponible entre las 11 de la mañana a las 6 de la tarde. También brindamos ayuda a través de nuestro programa de telemedicina de salud pública. Llame al 1-833-540-0473, cualquier día de la semana entre las 8 de la mañana a las 8:30 de la noche. Podemos responder a preguntas, ayudarlo a dirigirse a un sitio de prueba para tratar cerca de su hogar o conectarlo con uno de nuestros proveedores de atención médica para una evaluación médica a través de telemedicina. Si es elegible para recibir medicamentos, se enviarán de la noche a la mañana a su hogar. Puede obtener más información sobre cómo acceder a medicamentos terapéuticos para tratar el COVID en el sitio web en esta gráfica. Esta ha sido una pandemia muy larga y ha habido tantos cambios a lo largo, ya que ha tenido altibajos y han surgido nuevas subvariantes más transmisibles. Queremos expresar gratitud a los muchos trabajadores de salud y socios comunitarios a través del condado que continúan trabajando para protegernos a todos, incluidos los que corren mayor riesgo. Su trabajo para educar, detectar y detener la transmisión viral y brindar tratamiento rápidamente a los más vulnerables ha salvado muchas vidas y continúa haciéndolo. Gracias. Y ahora proveeré una actualización sobre la viruela del mono. Kim, I'll go ahead and take the next slides.
Give me 1 second, let me switch them over. Okay, Jackie, as long as you can see it, you're welcome to start when you're ready.
Great, thank you so much. Me da mucho gusto poder brindarles una actualización sobre la viruela del mono. Esta semana daré actualizaciones sobre la situación, el perfil demográfico y geográfico de los casos en el condado de Los Ángeles y sobre nuestra elegibilidad y distribución de vacunas e información acerca del tratamiento contra la viruela del mono. El número de casos de viruela del mono sigue aumentando a través del mundo y aquí en los Estados Unidos. Al 24 de agosto tenemos más de 45,000 casos de viruela del mono en 98 países. Esto incluye más de 16,600 casos confirmados en los Estados Unidos, de los cuales 3,068 casos están en California. Hasta la fecha se han identificado 1,204 casos de viruela del mono en el condado de Los Ángeles. Además, ha habido 68 casos reportados en Long Beach y 17 casos reportados en Pasadena. Aunque hace un mes estábamos viendo una duplicación de casos de viruela del mono en tan solo 9 días, ahora estamos viendo una nivelación en el número de casos nuevos por semana y nuestro tiempo de duplicación ha aumentado a 16 días. Esta puede ser una indicación temprana de que la transmisión está comenzando a disminuir. Se observan tendencias similares en los países donde comenzó el brote y en otras jurisdicciones de los Estados Unidos. La edad media de los casos de viruela del mono en nuestro condado se mantiene en 35 años. En el condado de Los Ángeles ha habido 47 hospitalizaciones entre personas con viruela del mono. Estamos en el proceso de caracterizar aún más aquellos que han sido hospitalizados y esperamos tener más detalles para compartir en el futuro. Ha habido 5 muertes en países que históricamente no han reportado la viruela del mono. Sin embargo, aún no se han reportado ni una muerte por viruela del mono en el condado de Los Ángeles ni en los Estados Unidos. Esta semana informamos un total de 6 casos en entornos congregados que incluyen, entre otros, albergues para personas sin hogar. No hay nuevos casos en la cárcel. Next slide, please. Salud Pública continúa siguiendo el perfil demográfico y geográfico de los casos de viruela del mono en el condado de Los Ángeles. Todos los viernes se actualiza nuestro tablero para incluir los datos más recientes. El perfil de casos en el condado de Los Ángeles sigue alineándose con lo que se está viendo a través del país y el mundo entero. A partir del 19 de agosto, el 98% de los casos de viruela del mono reportaron ser hombres. En el 82% de los casos, las personas se autoidentificaron de orientación sexual gay o bisexual, y al excluir los casos en los que se desconoce la orientación sexual, aumenta al 97%. Los residentes latinos y blancos continuaron representando la mayor proporción de casos, representando el 38 y el 32% de los casos respectivamente. Además, el 12% de los casos de viruela del mono se dieron entre residentes afroamericanos y el 4% entre residentes asiáticos. Next slide, please. Aunque seguimos viendo casos de viruela del mono, el riesgo de infección en la población en general sigue siendo muy bajo. Geográficamente, 46% de casos se encuentran en el área de planificación de servicios, SPA por sus siglas en inglés. Número 4, la región metropolitana que se muestra en morado en este mapa. El 15% de los casos se encuentran en el SPA 2, la región del Valle de San Fernando y el Valle de Santa Clarita, que se muestra en azul. Las otras SPAs siguen teniendo un 10% o menos de casos y SPAs 1 y 3 siguen con la menor cantidad de casos. Next slide, please. Salud Pública continúa distribuyendo y administrando rápidamente las dosis disponibles de la vacuna contra la viruela del mono. Hemos recibido más de 72,000 dosis de la vacuna Jynneos hasta la fecha en las fases 1 a 3 de las asignaciones federales. Hasta la fecha, Salud Pública ha distribuido todas estas dosis y el 67% del total de dosis recibidas se ha administrado. A principios de esta semana, el gobierno federal anunció sus asignaciones de fase 4 de más de 360,000 viales de la vacuna Jynneos que fue hecha disponible a las jurisdicciones en la fase 4. El condado de Los Ángeles se le han asignado 24,767 viales o alrededor de 120,000 dosis. La distribución de las dosis de la fase 4 se realizará en 3 tramos y cada tramo representa 1/3 de la asignación. El condado de Los Ángeles acaba de recibir el primer tramo de esta asignación, que son 8,260 viales o aproximadamente 41,300 dosis. Los siguientes tramos estarán disponibles una vez que se administre al menos el 85% de estos viales. Estamos estimando que con las dosis que recibirá el condado de Los Ángeles en la fase 4, podemos vacunar completamente a casi 100,000 personas con la serie de 2 dosis. Esto es aproximadamente el 56% de la población en riesgo, estimada en 180,000 personas en el condado de Los Ángeles. Next slide, please. En respuesta al anuncio de la asignación de vacunas de la fase 4, Salud Pública amplió la elegibilidad de vacunas para incluir residentes adicionales con alto riesgo de contraer la viruela del mono. Los hombres gays o bisexuales y las personas transgénero que tuvieron parejas sexuales múltiples o anónimas en los últimos 14 días han sido elegibles para la vacunación. La elegibilidad ahora se ha ampliado para incluir a hombres gays o bisexuales y personas transgénero que hayan tenido contacto piel con piel o contacto íntimo, como besos y abrazos, con personas en grandes lugares o eventos en los últimos 14 días. Además, las personas de cualquier género u orientación sexual que hayan tenido sexo comercial o transaccional en los últimos 14 días, es decir, sexo a cambio de dinero, vivienda, comida y otros bienes o necesidades, ahora también son elegibles para la vacuna contra la viruela del mono. Los residentes que cumplen con los criterios de elegibilidad anteriores siguen siendo elegibles para la vacunación y continuamos dando prioridad a los residentes inmunocomprometidos, incluidos aquellos con VIH avanzado o no controlado, ya que pueden tener un alto riesgo de enfermedad grave. Los residentes que no tengan acceso al Internet o que necesiten ayuda para acceder a la vacuna pueden llamar al Centro de Llamadas de Salud Pública al 833-540-0473. Nuestro personal está disponible para recibir llamadas los 7 días de la semana, de las 8 de la mañana a las 8:30 en la noche, en varios idiomas. Next slide, please. Los residentes del condado de Los Ángeles que sean elegibles para su primera o segunda dosis de la vacuna contra la viruela del mono pueden aprovechar varias opciones para vacunarse. Ahora tenemos 53 proveedores comunitarios que activamente están vacunando a sus pacientes contra la viruela del mono. Alentamos a los residentes que son elegibles para una primera dosis a que se comuniquen con su proveedor de atención médica regular y pregunten si ofrecen la vacuna contra la viruela del mono. Los residentes que son elegibles para recibir su primera dosis también pueden preinscribirse en el sitio web de Salud Pública para vacunarse a través de los sitios PAR comunitarios y de Salud Pública. Esta semana, además de los sitios en West Hollywood, Silver Lake, El Monte y Hollywood, hemos agregado un sitio en Highland Park y otro en Hollywood. El enlace de preinscripción está actualmente abierto y estamos tomando inscripciones. Alentamos a aquellos que son elegibles a visitar ph.lacounty.gov/monkeypox para registrarse. Con la adición de las dosis de vacunas recibidas la semana pasada, Salud Pública y otros proveedores ahora ofrecen segundas dosis a los residentes elegibles. Los residentes que recibieron su primera dosis de la vacuna contra la viruela del mono hace más de 28 días y no han tenido la viruela del mono deberían hacer arreglos para recibir su segunda dosis ahora. Recomendamos que los residentes regresen al lugar donde recibieron su primera dosis para recibir su segunda dosis. Aquellos que fueron vacunados por su proveedor de atención médica deben comunicarse con ese proveedor para programar su cita para su segunda dosis. Aquellos que se registraron a través del sistema de registro de salud pública y recibieron una primera dosis en un sitio de salud pública o PAR comunitario recibirán un mensaje de texto con información sobre cómo recibir su segunda dosis cuando corresponda. Salud Pública invitó a más de 8,000 residentes que debían recibir su segunda dosis a partir del miércoles de la semana pasada. Next slide, please. En el brote actual, la mayoría de las personas con viruela del mono tienen una enfermedad leve y se recuperan sin ningún tratamiento, generalmente entre 2 a 4 semanas. Sin embargo, el medicamento antiviral tecovirimat, también conocido como TPOXX, está disponible para tratar a personas que tienen una enfermedad grave o complicaciones de la viruela del mono, o personas que están en riesgo de una enfermedad grave. TPOXX es un medicamento antiviral aprobado por la FDA para el tratamiento de la viruela humana. También está aprobado para tratar la viruela del mono durante los brotes bajo un protocolo de acceso ampliado por ser un nuevo fármaco en investigación, IND por sus siglas en inglés. TPOXX puede acortar la duración de la enfermedad y reducir el riesgo de muerte. Los datos disponibles indican que TPOXX es seguro y solo tiene efectos secundarios menores. El proveedor de atención médica determinará si recetar TPOXX a su paciente. Los ejemplos de posibles indicaciones incluyen tener dolor o lesiones que son tan graves que interfieren con las actividades de la vida diaria o estar en riesgo de sufrir una enfermedad grave, incluidas las personas inmunocomprometidas, menores de 8 años, embarazadas o lactantes. Para aquellos que no tienen un proveedor de atención médica, pueden discutir el tratamiento con la enfermera o enfermero de salud pública que se asignó a su caso. Esta persona realiza la entrevista inicial con cada caso de viruela del mono y brinda recursos y referencias para cualquier necesidad que pueda tener el caso. Esto incluye la navegación del paciente para garantizar que el caso tenga acceso a un proveedor para la evaluación de TPOXX. Next slide, please. TPOXX está fácilmente disponible en el condado de Los Ángeles con 500 sitios a través del condado que ofrecen este tratamiento a pacientes elegibles. Hemos colocado este medicamento en 35 centros que atienden a 465 sitios satélite como centros de salud, clínicas y todos los hospitales del condado de Los Ángeles. Salud Pública brinda consultas logísticas y clínicas a los proveedores que tienen preguntas. Para garantizar el acceso a este tratamiento importante para nuestras comunidades marginadas, Salud Pública ha priorizado la incorporación de sitios como clínicas comunitarias y centros de salud calificados a nivel federal que atienden a estas poblaciones. También brindamos tratamiento a través de clínicas de salud pública y hospitales del Departamento de Servicios de Salud del Condado de Los Ángeles. Next slide, please. Para terminar, tenemos una variedad de recursos educativos sobre la viruela del mono disponibles para residentes, proveedores y socios comunitarios en nuestro sitio web. Estos incluyen preguntas frecuentes, volantes, panfletos, letreros y varios documentos de orientación. Los alentamos a que visiten ph.lacounty.gov/monkeypox para acceder a estos recursos y a la información más reciente sobre la viruela del mono. Los residentes también pueden suscribirse a nuestro boletín para recibir actualizaciones sobre la disponibilidad de vacunas y el registro previo y otras actualizaciones. Y nuevamente, los residentes que no tienen acceso al Internet y necesitan información pueden llamar al Centro de Llamadas de Salud Pública al 1-833-540-0473. Tenemos personal listo para atender a su llamada en varios idiomas, los 7 días de la semana, de 8 en la mañana a 8:30 en la noche. Gracias. Thank you, Kim.
Thank you, Jackie. Thank you to everyone who joined us today. Additional media questions can be directed to our media inbox at media@ph.lacounty.gov. Thank you once again for joining us, and we'll see you next week.